My name is Nicole, and I'm an audiologist, and I am based out of Omaha, but I also do satellite clinics here in Manning and other towns in Iowa and Nebraska. So audiology, what it really means is hearing science. So what audiologists do is we diagnose and treat hearing loss and vestibular disorders or balance disorders. There are some balance disorders that can be caused by your inner ear as well, so we treat those. So what we do is full comprehensive audiograms. We also test eardrum function and we look at word understanding as well. An ear, nose, and throat physician is going to be in charge of diagnosing and treating disorders of the ears, nose, and throat. An audiologist will diagnose and treat hearing loss. So the way I kind of decipher is one's an ear doctor and one's a hearing doctor. So a lot of times we'll do hearing tests prior to a patient seeing the ear, nose, and throat physician to kind of give them an idea of if the patient does have hearing loss, where is that occurring in the auditory system. The main one is going to be any sort of hearing loss, whether it's long-standing, it's been there for a while, or a sudden drop in hearing. We can diagnose both of those with a comprehensive hearing test. If someone has struggled with hearing loss for quite some time and want to try some hearing aids to kind of see where they're at, we can also do a hearing test to kind of give them an idea of if a hearing aid would be an appropriate fit for them. Other things would be if you have a child that fails a school screening or a child that's having recurrent ear infections. Those would be patients we'd want to see with an audiologist and ear, nose, and throat in conjunction. When you're reaching the age where hearing loss is more common, 50, 60, 70, I would get more routine hearing tests versus, younger generations that don't quite have the difficulty quite yet. Otherwise, if you're noticing any difficulty, things like that, definitely get in to see us. Repercussions of undiagnosed hearing loss can be delays in language, delays in hearing, things like that. So, if a kid is not hearing at a normal level, then a lot of times their language won't develop at a natural rate, or words will come out a little bit differently than they should just because that's how they're hearing them. It can also cause some delays in school. Another thing I always caution people on is what we call auditory deprivation. The longer your ears go without sound, the harder it is to reintroduce sound. So after a while, sometimes we'll see patients who have had hearing loss for quite some time. Their word understanding is not where we'd like it to be, even with amplification. And it's just because that auditory nerve hasn't had the stimulation it needs. So a lot of times it's more important to get in sooner to keep that auditory nerve active, keep that brain pathway moving. That way with amplification, you still can understand speech. There are some forms of hearing loss that it might be caused just by fluid, and it could be a surgical procedure that would take care of it. Otherwise, most individuals have what we call sensory neural hearing loss, which is not something we have a magic pill or special surgery for. It's that age-related hearing loss most of the time. Hearing aids are usually a good option. That's kind of why we look at our word understanding speech scores to kind of help with that, to see, if I can compensate for that hearing loss with amplification, are you able to understand speech? There are some types of hearing aids that do a little bit better depending on the hearing loss. But there's a lot of different options. And then as far as adjusting the hearing aids, we've made strides in technology. So hearing aids from 10 years ago are completely different than what they are now. For those individuals who have a more severe hearing loss where they aren't finding benefit from hearing aids, those are the individuals we look towards cochlear implants. If there's any patients who are in need of a hearing test or have a child that's in need of a hearing test, or interested in hearing aids, or even just chatting with me about the options that are out there, I'd be happy to see them.
Manning Regional Healthcare Center, your trusted experts close to home.